This case involved a dog bite. Our client was at a client's home of hers when the dog that the family owned bit her on the bridge of her nose when she went to pet the dog. The client was in her 60s when the bite occurred, and the bite required that she go to the hospital and have stitches to repair the location where she was cut. And fortunately, there was no infection, and fortunately, there was no issue in terms of additional medical follow-up to avoid infection. But she was left with a scar on the bridge of her nose, and she developed what's called a keloid, which is effectively built up scar tissue that she was self-conscious about and was bothersome to her. And it was not something that she was willing to just live with. She ended up having to go see a facial plastic surgeon who did many, many different laser therapies and laser treatments to try and reduce, remove, improve the look of the bridge of her nose. It took years for her and many, many laser therapies before she finally got to a point where it looked and continues to look much, much, much better, although not entirely healed. We were able to pursue a claim against the owner of the dog, who luckily had homeowners insurance, which typically covers dog bites. They were able to see all the medical records, and their insurer was able to evaluate things relatively quickly. And within 2 months of our client completing her treatment, we had negotiated a settlement on her behalf of $175,000.